A warm welcome back on the AM show, and as we've intimated to you, today our focus is COVID, a year on. You can actually also share your thoughts with us on social media. A year of COVID. Do share your thoughts with us. But right now, it's an interaction I have had with the Director General of the Ghana Health Service, Dr. Patrick Kumabwaje. If you've been wondering, I've heard talk about the 600,000 AstraZeneca doses we've had, amounting to 6 million because each was worth 10 doses. That actually, well, you'll be getting the answers from Dr. Patrick Kumabwaje. He also talks about how it has impacted healthcare professionals, what the real statistics are. Just stay with us as we have this interaction. That's up next on the AM show.
Wave in June, July, August, where we had a massive wave with a large number of cases across the country, mainly in Accra and Kumasi. We came down around about December. November, we have a little hump, which is common for all pandemics. And then in December, end of December, we had a second wave, which we are currently is slowly easing out of. And so that has been the case. There's been a lot of activities in between, and our ability to, our attempt to respond, both from the side of the government, from the side of the people, and other partners to ensure that we are able to weather the storm by preventing importation of the cases, making sure that we are able to test, treat, and contain. We're also making sure that we have domestic capacity to respond to the pandemic, because you realize that all your needs, every country in the world needed some, and so people have to look within to see how do we also find our PPEs, etc., to be able to show up the storm. So that has been our trajectory, and of course trying to mitigate the impact of the pandemic, which is the economic impact, social impact, and we have to respond to all of that.
From the standpoint of the Ghana Health Service, what would you say led to this second wave in December that you spoke of? What was it that we did wrong?
Well, I wouldn't say it is something what we did wrong, but it was something that was probably predicted, in the sense that these cases were imported, and we also knew that around Christmas there's a lot of activity, there's a lot of movement, both within country and our own compatriots who are coming back and visitors coming back. And so there were different strains, new strains, variants outside of Ghana. And it came in, and the cases blew up, because we had a very long Christmas from Monday, or there was a Monday or so, so there's almost 4 days of celebrations, close contacts, etc., and that led to where we got to.
So some sloppiness on our part. We let our guard down for a bit, because there had been the political campaign season, and all the politicians from different angles had been involved in different ways. The Christmas, then of course the declaration of the electoral results, and all of that leading into the coming year. So,
but one thing that I keep mentioning is that, you see, this is a disease that has a very definite timeline. Usually 2 weeks. If I come in contact with you within 2 weeks, if I don't get it, then it means that I was really not infected. You may prolong if you get it and you fall sick and you continue. But even they may even get negative whilst the disease continue to. So we really have continued to explain to people that, interestingly, the campaign did not show any evidence of increasing coverage, because it was done all over the country. And until the Christmas hike, we had an active case of about 300. And so,
but right after Christmas, we saw the numbers surge again, go up into the thousands.
Well, we have finished elections. We had actually followed up post-election up to the 20th of December. Still, everything was quiet until about 30th of December, when the Christmas festivities are taking place. And of course, some of the initial, even the cases of mass protests, etc., in small places, still did not show anything. Because we are giving ourselves after about the 20th to 22nd. And so one can assume that that was not the trigger. But then once what we predicted that in Christmas, people are going to move all over the country into Accra to buy and go back and sell. We're going to have people who are coming in from abroad, UK, family, friend, members, US, etc., all coming home for Christmas. And it happened. And you saw that the number of cases that were picked at the airport went up very, very high. It was virtually 4 times what we had in, say, November. And so these were all the triggers, and coupled with the fact that we also had the UK strain, which subsequently we found that they had brought into the country, which spread faster, is more virulent, and that's what we have.
Now, here's something that just came to mind, and I want to run it by you. I have had COVID and recovered from it earlier this year. Have you had that unpleasant experience? What was it like, if you do care to share?
I have not. Even I've tested several times. Fortunately for me, I have not had COVID.
Lucky you.
Well, I think there may be some element of luck, but I think my adherence to the protocols, I believe, has been very good. My office people will tell you that I rarely take off my mask. Even when I'm eating, they will tell you that
you keep your mask on?
No, in between. I'm drinking a cup of tea. When I sip, I put it back on.
Right.
You know, so, and I think that has also been very helpful, because unfortunately, I've also been around many people in meetings where there's been an outbreak. But in all that, I've been lucky. But I've seen many people suffer because of my position, so I know exactly.
Yes. I was asking it from that standpoint, actually, because if you've suffered it, if you know what it's like, how uncomfortable it is, and even when you're going through things and wondering whether you're going to make it, your appreciation of the matter tends to change.
Different. Yes.
So
yes.
That was the standpoint.
But I've been lucky. But I've had my colleagues who have had it.
What would you say has been the impact of COVID-19 on the health sector in Ghana?
Yeah, thank you very much. Once you have such a big pandemic, there's a tendency to abandon other things and focus on the immediate threat, which is the pandemic. It initially, in the first 2 quarters, affected significantly a lot of the public health services. People were afraid to go to hospitals, and so outpatients attendance also dropped. But fortunately, we had anticipated that we were going to have that. And so the first thing we did was, in March, develop some a protocol to look at how we keep essential services going, especially in the areas of maternal and child health, which are areas of core importance, and we cannot joke with it. And so, but it still had an effect in some regions, but eventually there was some recovery, but there was some reduction in outpatient attendance. It was quite low. People were not utilizing the services. There was also a reduction in some form of API coverages. In some regions declined, because these are areas who move into people's home or mass in a group, like the child welfare clinics, which is more of a gathering, which we stopped. And so we're not able to do much. But towards the last 2 quarters, we were able to catch up. The other impact was that the protocols had also led to a situation where personal hygiene had improved. And some of the core areas of diarrhea in children was reduced by about 30%. And all the diarrhea disease in the country also significantly came down. So those were some of this was more of a positive effect of that. And we believe that these are practices that we need to really continue to keep up.
Let's talk about the hands-on effect of COVID-19. And again, the focus is the health sector. We've had some health professionals going down with the virus.
Yes.
And just a few weeks ago in Ketu South, there were about 15 people in one of their hospitals who had actually supposedly contracted the virus. In that same facility, there was talk of a nurse who got it, took it home, and both she and her husband, unfortunately, did not make it. So what is the reality in the Ashanti region as well? We've heard of complaints from the Medical Association about members going down. What is the reality? What is the true picture? What are the numbers you can share when it comes to how it has impacted the health sector or health professionals?
In terms of the number of people who were officially reported positive, we are doing nearly 4,000 and counting. We had lost about 14 people that we know, but we know that the number in this year has also gone up slightly. And so it's been a major challenge for us. We have had to close a few hospitals a few times because there was an outbreak in those facilities. And that's how we've had to deal with it. But by and large, it was quite high in the early stages of the disease because adherence was a problem, appropriate use of PPEs and availability of PPEs in the initial phase was a challenge. But we have subsequently, the rate of infection among the health workers has come down. But occasionally we have some outbreak like what happened in Sablogo Hospital, which sometimes when you have a major outbreak like that, it's usually a failure, a systematic failure of a protocol. That's how you have so many people get it. So once we get it fixed, you see some stability. And we continue engaging our facilities to make sure they use their PPEs and use it all the time and not assume that my colleague health worker is safe, but it's the patient who is carrying. But it's both ways. And so that's how we have approached it. And we've also had to do a lot of studies, a lot of training, a lot of orientation to ensure that people appreciate how it's done, how we contract it, and how we can prevent it. Also ensure that we don't also bring it from our house into the facility.
Now, these frontline workers, the medical staff, they've also been incentivized in certain ways. Are those incentives, the insurance packages, the bonuses, are they still getting them?
There was an insurance package for those who contract, and I think that is currently being worked on and people are being paid. We also had a free...
So they're still receiving it?
Yeah, they're still receiving. There was tax incentive. There was a 50% bonus that health workers, frontline health workers were getting, which is being paid. The difficulty with the 50% is that it is not the same person for the last 6 months. It changes. And so the paperwork...
So the people, the beneficiaries keep changing?
Yeah, keep changing. So the paperwork is quite a bit laborious, and so it's a bit slow in catching up with everybody. So you can have somebody in Kintampo last month, he was there, he is no more there, someone else takes over. And so you need to continue updating the data and work. So that's how...
What makes someone a key frontline worker who will benefit from this? And maybe you could add about how many people are we looking at, even among the healthcare professionals?
I will not be able to
at any point in time.
Well, you see, it depends on the total number of... let me give you what is a frontline worker. Somebody who is likely to come, who has a higher propensity to come close to the virus. Someone who works on the virus. And so you have people who are doing triaging at the outpatients, and the other one who are screening people to see who can go here, who cannot go here. They are anticipated to be exposed at a higher risk. We also have people who are assigned to take care of people who are actually positive in the treatment centers, in the ICUs, among others. Okay. We also have contact tracers who go home to follow contacts of people who have been exposed. So those are what we classify, and of course those who are in the labs who are actually doing the tests. And so those who have the higher propensity to come close to the virus and those who are actually working on the virus are the ones we classify as frontline.
Okay. This bit about contact tracing that you mentioned, it appears to have slowed down. Why?
It hasn't. It hasn't slowed down. You see, contact tracing is you follow contacts of those who are positive. So if you have 10 cases today, and we used to have an average of about 11 contacts per case, if you look at the data across the period that we've had. And so we are looking at probably times 10. And so it's not the same as if you have 100 cases.
Okay.
Then your contacts will be high. Okay, and so when you look at it, if you looked at when we started having this second wave, and we're reporting about 800 or so cases, you saw the number of contacts, the number of tests that were being done went very high. And so that's how it works. Sometimes people confuse the testing that was done during the lockdown. That was what we created as a country called enhanced contact tracing. We wanted to study how far is the virus, and so if we get to a town, we may decide that let's do a perimeter of about half a kilometer around this place where there was a case to see whether there's anything there. That's not contact tracing. That was just community surveillance to see are there anything there. And so you're going to see a large number of cases, tests being done. And I believe we did more than 50,000 in a very short time. We also are doing enhanced contact tracing, where we were doing even any contacts at all. You see, so those were the cases that was happening. And we were doing a lot of sweeping, and we also doing risk assessment. So we wanted to check how risky is the market. So we come to the market and test a few people at random to see whether we have cases there. We go to trotro drivers and see let's see how risky is it. So we test them. And those are the reasons why we could say that maybe the market is not as risky as we anticipate. And we later learned that because of the ventilation, because of the openness, the transmission is much, much lower. So at that time, we did all that to study Ghana's situation, study the virus for our response. And so subsequently, we are doing the appropriate contact tracing, where we are looking at contacts and following their cases and following their contacts. And testing their contacts, actually.
Now, speaking of our peculiar situation, you would notice that, and of course you would know, our numbers are beginning to drop in terms of the cases we are seeing. What do you think accounts for that? Because on the back of some of what you've been saying, I remember just a few weeks ago you were talking about the fact that mask-wearing protocols were not being adhered to, even right here in Greater Accra. It was becoming a problem. Is that any better now? Are people following the protocols better? Is that what is accounting for the lower numbers?
You see, in December, apart from the risk that we pose with Christmas and activities, the mask wearing has significantly declined, and we talked about it. We had dropped almost 7%. After we had peaked about 42% or 44% earlier, and intention to wear was about 85%. Now, after the surge, we also saw, and with the advocacy and communication and with the media coming in, the mask wearing rose up to about 52%. And that is when we started seeing the decline in the cases. And so currently, the mask wearing has gone up. I can see there's a little decline now because people are feeling a bit more comfortable. And that's why we need to continue encouraging people that clearly you will need to continue wearing your mask to any help. And we saw that when it went up, the cases started coming down. So it works. And so that is what has accounted for that. Of course, people started washing hands. We had reintroduced the shift systems in workplaces, and we believe that the private sector in their workplaces became a bit more vigilant in terms of separation and doing shifts, and so all those areas. And of course, we also had to put in further restrictions. The government had to come in with further restrictions in terms of reintroducing a ban on funerals and restricting the number of people in churches and other social gatherings, banning weddings, etc., even though they were there, but it was reinforced. And so all those reduction in mass gathering and the mask wearing protocols has accounted for the reduction in the cases.
I want us to shift our attention now to vaccines, vaccination, and how far we've come. But even before we dig into it, on the back of what you just said, it brought to mind something. I see and hear some people also saying, oh, well, I've got the vaccine shot, so there's no need to use a mask. There's no need to do this. There's no need to do that. From where I sit, I know also that the second shot, your exposure is still more, and you would need the second shot to get as much protection as is possible and all of that. So this is the thinking of some ordinary Ghanaians. What would you say in reaction to that?
What we continue saying that even if you have had your second shot, please continue wearing your mask. No, the vaccine, none of the vaccine is 100% protective. And so what we are setting off is that it can protect you from severe disease, it can protect you from getting a critical disease, and most especially death. But it doesn't stop you from getting the virus and also transmitting it to somebody who may not be vaccinated. And so we want everybody to continue vaccinating. Remember that children under 18 and pregnant women, until we get the appropriate vaccine, will not be vaccinated, and they are not protected, and so we need to be able to protect them. And so all of us must be able to continue wearing our masks. And so it's very important people get a message that, yes, it prevents you from severe disease and death, but it may not prevent you from catching the virus until a significant number of people in this country, probably 75–80%, are vaccinated. Then we can study the virus and see what is the trend like, and then such a decision will be made. This is a new virus, and we continue to learn more about it, about the virus. We have new variants that comes up and down, and so we still need to be on our guard, even with our vaccination.
How successful would you say vaccination drive has been thus far? We took stock of some 600,000 of them, and even the breakdown, some have said 600,000, but each one contains, is it 10 shots and all of that, so it's actually 6 million. No. What is the reality? This is something that I've heard even media people say. So what is the reality? Does 600,000 equal 600,000 individual shots? And how successful has the program been so far?
Yeah, in the last 1 week we've done more than probably we've done more than 300,000 plus since we started. And looking at the anticipated hesitancy, which we have not seen, a lot of people are very eager to have the vaccine. Even though, because of the segmentation, we are focused on a certain category of people who are taking the virus. And that's what I'm sure if we had opened it out to everybody, probably the vaccines would have been finished by now. And so that is what we are. I think the reaction of the people have been very good. We have had, the largest group has been the people over 60, as the elderly, followed by the health workers and those with comorbidity. And so it's in all the places that we are doing for now.
Is it a worry? Because I see some people who are not in the category supposed to be vaccinated, all of them trooping to centers. Is that a problem?
Well, you see, we are talking about segmentation. The segment included people who are vulnerable, people who are at high risk, and that's why we also added media to it. That's why we added the security people to it, and that's why we added, policemen who are always in the streets, and so the judiciary, the state must run. And so some of the essential services, people who are managing our water, those who are managing our electricity. And so if you look at that number, you may think that, oh, they are not the vulnerable. So you have the vulnerable and the essential services, and that's how you see. So if we see you, then I'll say, oh, it's a young man, why is he going to take? You are a media person, you are exposed to many people, you are running around talking to so many people, so we feel that you must also be protected. So that's the sense in the segmentation that was done.
Okay. At what point are we going to start using the Sputnik vaccine, for example? It's one of the two we've approved, AstraZeneca and Sputnik. At what point are we going to use it?
It's been registered. We have made orders. And as soon as the orders come in, we're expecting more from the COVAX facility. As soon as the orders arrive, we already have a small quantity here. As soon as the orders arrive, we will start using them because we are ready People have been trained to use it. We're just waiting for the orders to arrive. As soon as they arrive, to be used.
So if it's part of COVAX, then that means it's free?
No, Sputnik is not part of COVAX, so we're buying.
Okay, all right.
The state is purchasing.
So we're purchasing it directly from Russia?
Because COVAX gives us 20% of our needs. And so 80% of the people, the government has to buy it. And that's what we are doing. So we secure that, and we're also doing bilateral. The government is doing the bilateral arrangement to ensure that they're able to get additional vaccines, including AstraZeneca and all of them, so that we can continue to vaccinate the people, because the COVAX vaccine will give us about 12 or so million doses.
The South African variant is the most difficult one to deal with currently, but it's also shown its own, should I say, weaknesses in fighting the coronavirus, at least the sort of variant we've seen come out of South Africa. And AstraZeneca is what we are bringing into Ghana now. Do you have any concerns? Has the health service any concerns with regard to if the South African variant becomes predominant? Do we even know which of the strains is dominant currently in Ghana?
The dominant variant is the UK variant now.
In Ghana?
In Ghana.
Currently?
The South African one is quite small.
Okay.
And even that, AstraZeneca has been found to be quite effective, even against the South African variant. And so,
from what I hear, severe cases, yes, but mild to moderate, the effectiveness can drop to below 10%. Is that not a concern? Because that's what we have now on a massive scale.
I think those were the earlier stages, but the strategic advisory group, having studied the going, felt that it's still quite safe enough for all. And like I'm saying, that all the viruses, I mean, if a vaccine protects you from severe disease, and I think that's what we're all afraid of. And so it's still good enough for that. But fortunately for us, the dominant strain is not a South African strain. And so for now, we are okay. And I believe that we are not just going to limit ourselves to AstraZeneca and others, because of the global push for every country wants vaccines. You need to have a mixture of everything. Sputnik, whatever, Moderna, anything you can get, you put in, and then you give it out until you cover all your people.
Okay. So in the next, let's say, 1 week, 1 month, what is the Ghana Health Service looking forward to doing as we keep up with the vaccination drive, as we keep pushing back against this virus?
We will continue vaccinating till about October. Our plan is that we are hoping that by October we would have vaccinated everybody. By June we would have vaccinated about 20 million of the population.
By June?
By June. And we are hoping that the inflows and all the arrangement that has been made comes through and the vaccines will come. And we are expecting that the next 2 or so months, more vaccines coming in from the COVAX facility, from the bilaterals, and then we'll continue vaccinating people until such time, just like other countries are doing, every Ghanaian is vaccinated. Hopefully that by June, July, we would have had a vaccine that is deemed safe for children under 18 and pregnant women. And by that ways, we can now vaccinate practically everybody.
We're looking at COVID-19 a year on, March the 12th last year till now. And we've had our wins, losses, hits, misses. Yeah. What would you say are the core lessons we've learned from this pandemic as a health sector, a health system? What are the lessons that they take away?
One of the most important lessons is that this is an all-government approach, and everybody has a role to play. And this is not just a health matter, and that the media, the environment, people, finance, everybody has a role to play in our response. We've also learned that there are certain cultural practices that lead to some of these diseases. And if you have noticed that in the last few years, H1N1, Ebola, etc., they are all transmitted by close contact. And so there are lessons there that we can look at. How do we manage our space? How do you manage our offices in a way that even subsequently we do not get hit? How do we avoid congestion in areas? How do we create ventilation in our areas? And so these are all very important lessons that I believe that we should even go into our housing code, so that subsequently we have a much freer environment to live in.
Okay, as we get ready to wrap up, Doc, yesterday we had the SONA, the President, His Excellency the President, made mention of a number of things, but there was not any new intervention or program to aid in post-pandemic recovery, so to speak. Any concerns in there for you? What we have so far, are they enough to sustain us, not just on the health front, but whatever happens to our economy as well also impacts our fight against COVID-19. What do you think? What do you see?
Well, I don't know whether your statement about nothing new is, I share the same view, but I believe that there were many areas of trying to revamp the economy. There are many areas of building a resilient health system, and I believe that is what COVID has not still means that we need to continue building our system to treat. Our surveillance system has to be improved, and I think all those things are currently being catered for. That I believe that once we do it well, we should be okay.
Well, this might be something to rejoice about. At least we've known of it, and that's the very final bit. Agenda 111, and these 100-bed district hospitals in 100 plus 101 districts, and then we are looking at the recruitment of healthcare professionals and all of that. Welcome news.
Yes, I think it's a welcome news. Well, maybe one of the things that also COVID has shown us the fact how important the health sector is, and that good health has major impact on our economy, on everything that we do, and our social life. And so it's a welcome news that we are using this opportunity to also build capacity within the health sector, ability to respond and to treat people, and so we are very happy that the government has taken that initiative.
Okay. I would have you share a message with ordinary Ghanaians. A year down the line, we have come far, but there's still a lot more to be done. What would be your message as Director General of the Ghana Health Service to ordinary Ghanaians as we continue to battle this pandemic?
My message will be two. First is that people must see this vaccination as a civic responsibility, that you protect yourself and you protect your neighbor, and so everybody must get vaccinated. Secondly, the use of the protocol still remains very, very, very important, that we stick to the protocols, because apart from not getting COVID, there are other benefits of the protocol that have been introduced, and I think it is something that we need to apply, that so that we can save ourselves, save our loved ones, and then we can move on, get back to our normal life, and get to improve our social services as well.
Well, Doc, it's been insightful, it's been refreshing, sharing thoughts with you on COVID-19 a year down the line. And we're hoping that come next year by this time, we would have a much better story as well to tell. Not just Ghana, but across the world.
I believe that the vaccine should be the beginning of the end of the pandemic. And that's the hope we all have.
But still, a cure is being sought. And hopefully if we
Definitely,
get there,
nothing has
much
stopped.
better.
We are still, people are testing treatment options, etc. The flu came in 1918, it's still with us.
Yeah.
Thank you.
This has been our interaction with Dr. Patrick Kumabwaje, the Director General of the Ghana Health Service. He's been gracious enough to interact with us a year on after COVID first touched the shores of Ghana. The fight still continues. Continue to observe the protocols and do get vaccinated when it's your turn. Thank you for staying with us.